Alright, everyone, Rasim here. And today Dr. Esma and I are diving into something people think they fully understand, until they don't. Full mouth dental implants may look straightforward, but there's a twist most patients never hear about. And trust me, once you know it, you'll never look at those before and after photos the same way again. So, Dr. Esma, can we finally talk about the part that makes patients go, wait, nobody told me that?
Oh, absolutely, Rasim. Because behind those perfect smiles, there's a hidden detail that changes everything: cost, recovery, and even long-term comfort. And the surprising part is that many people walk into clinics without realizing they're choosing between two completely different futures. Stay with us. In the next seconds, you'll see exactly why.
So, Dr. Esma, here's what people keep telling me. Rasim, I just want to stop hiding my smile, eat comfortably again, and not feel embarrassed in photos. And I get it, most of us don't think about implants until chewing becomes a challenge or we avoid tough foods altogether. But the moment someone decides to fix it, they're hit with a confusing mix of options, promises, and big decisions.
Exactly, Rasim. Many patients come to me believing full mouth implants are a one-size-fits-all solution. But their bone structure, gum health, and even daily habits create very different scenarios. Some need stability for biting confidently, while others just want long-term comfort without constant adjustments. And when they learn how those differences change the entire treatment plan, you can see the surprise on their faces. Everyone realizes their case is more unique than they thought.
Dr. Esma, this is where things get real. People see those dramatic transformations, but they rarely understand what made the after possible. I've seen cases where someone went from avoiding social gatherings to finally enjoying a proper steak again. But none of that magic happens unless the treatment actually matches their bone strength, bite habits, and long-term needs.
Exactly, Rasim. For example, one patient came in believing all implants worked the same. But once we scanned the jaw, we discovered they needed a different anchoring approach to prevent future complications. Another patient needed a lighter, more flexible design to chew comfortably without strain. These differences matter. They decide how stable the smile feels years later and whether the patient can live freely without worrying about their bite.
Dr. Esma, something you told me the other day really stuck with me, that a large percentage of full mouth implant candidates actually walk in with bone levels far lower than they expect. They think it's just missing teeth, but the real story is what's happening underneath. And that hidden part can totally change the direction of their treatment.
You're right, Rasim. Many people don't realize that bone resorption can accelerate once teeth are lost. I had a patient recently who assumed implants were impossible for them. But after reviewing the scans, we designed a plan using strategic implant angles, and they were shocked at how doable it was. Moments like that remind me why understanding the background isn't optional. It determines whether someone gets a second chance at a confident, fully functional smile.
Dr. Esma, here's the part I think most people forget. Implants aren't just sitting there like little screws. There's a whole biological process happening underneath, so when someone says, why can't every mouth use the exact same implant plan? It's because the body itself plays a massive role in whether things stay stable.
That's true, Rasim. The science behind implants is fascinating. The bone actually bonds with the implant surface through a process called osseointegration. But the success of that bond depends on bone density, blood supply, and even the microscopic texture of the implant. Two patients can look identical on the outside yet heal very differently. That's why personalized planning isn't a luxury. It's the only way to ensure long-term strength and comfort.
So, Dr. Esma, if someone watching right now wants the best possible result, what's the actual step-by-step path? Because people imagine it's a single appointment, but in reality, there's a whole roadmap behind every confident smile.
You're right, Rasim. It starts with a precise digital scan of the jaw to see bone quality clearly. Then we design a personalized plan that maps exactly where each implant should go. After that, we create a 3D guide so placement is accurate down to fractions of a millimeter. Once implants are placed, the healing phase begins, and we monitor everything closely. Finally, we refit the permanent teeth designed to match the patient's bite and facial structure. Each step builds on the last, and that's why the final result feels natural, strong, and dependable.
Alright, Dr. Esma, before people rush into this, we need to talk about the big do's and don'ts, the things nobody warns you about until it's too late. Because let's be honest, one wrong assumption can turn a smooth journey into a stressful one.
You're absolutely right, Rasim. First, do choose a clinic that performs a full digital assessment. Without that, planning is guesswork. Don't ignore existing gum issues. They need treatment before implants. Do follow pre-surgery instructions carefully, especially regarding oral hygiene. Don't expect to return to tough foods immediately. Healing takes time and patience. And one more, do ask questions. The more you understand your own treatment plan, the better your long-term comfort and stability will be.